Hi, everyone. I'm Jamie Burse, and I'm joined today by Mike Crosby. We're from Zero to the End of Prostate Cancer. And Mike is a retired naval commander and a Top Gun fighter pilot. He's also a prostate cancer survivor. Mike, thanks for joining us today.
Thanks, Jamie. Nice to be here. It's my pleasure and an honor to be a part of Zero and doing great things for prostate cancer survivors and for men's health in general.
That's right. And we're here to talk today about our nation's veterans. A lot of people don't know this, but there are 500,000 veterans. Let that number sink in. 500,000 veterans who are fighting prostate cancer right now in the VA system. And so we're reaching out and talking to healthcare providers and doctors about how best to help our veterans. And one of the ways in which healthcare providers and doctors can help our nation's veterans who are fighting prostate cancer is through the Mission Act. And Mike, tell us a little bit about what is the Mission Act?
The Mission Act is actually a law now. It was passed into law in June of 2018. The official title is June 2018 Mission Act, and it was an appropriated amount of money for the Veterans Health Administration to take care of a number of issues that had been languishing through previous administrations. And really, one component of that was the replacement of the CHOICE program. Many people and many doctors may have heard of the VA CHOICE program, and that was a program initiated out of the Phoenix VA debacle in 2014 and 15 for the deaths due to long wait times. There was emergency funding put in place that was temporary, and it was put into permanent law in June of 2018. Along with that came the appropriation of $100 billion. Think about that one closely too. $100 billion have been appropriated over a 6-year period of time to care for veterans outside of the VA system. This is a different pot of money that Congress appropriated. Again, it's about $16 billion a year to pay for doctors' cares in the community. So if you're a provider and you're not signed up in this program, you're not eligible for any of those funds. So if you're a provider and you want to increase your business by seeing veteran patients, you need to sign up for the Mission Act. And we're going to talk you through how you do that. It's not very difficult, but I also encourage you to be an integrated system or an integrated provider and also want to help vets. I mean, that's what this is all about. And Congress has made that available, and you just have to sign up for it. And that's why we're talking to you today.
Now, Mike, what are the main benefits to providers for the Mission Act program?
So for providers, it's essentially the bottom line is more patients. You get the honor of treating veterans that need this care. Right now, with the case of oncology shortage or oncologist shortage at the VA, we need providers. We need to get these guys treated. With 16,000 patients with metastatic disease right now, it's a challenge to any organization. So that's one. We just need your help. You're going to be treating an additional patient in a reimbursable type of a situation. The money's appropriated, it's available, you're getting paid, and a lot of times a lot sooner than you are getting paid by Medicare or by the other insurance companies. I mean, we're seeing that reimbursement rates are between 17 and 20 days, which is quite short compared to a lot of the care issues or the reimbursement issues you're going through, right? And then you're also you're doing a good thing, you're helping veterans. Lastly, you get exposure to research programs inside the VA, clinical trials. You've got a large cohort database. If you're involved in your own trial, you can advertise and try to recruit from that database. So those are some of the immediate benefits, not to mention just thank you for helping those that have kept you free for all these years.
There are 4 steps that healthcare providers and doctors need to know in order to enroll in the program. Will you walk us through those?
Absolutely. Yeah, the first step is you got to know where you are in the country. The VA has broken up the country into 6 different zones. We are going to put out a flyer for providers that's 1 or 2 pages, 2 pages, front and back, to show you these steps. And there's a map on there, and it'll designate which zone that you're in. On the East Coast of the United States, that's handled primarily by Optum. On the West Coast, it's handled by TriWest. And right now, TriWest has been in the program for a few years through the Choice program. So theirs is all online. There's a website address that a provider goes to, and they log into that website, and they'll immediately be taken to a sign-up page, and then they go through the Community Care Network sign-up page. Now, this is different than there's TriWest, right, which is where you want to be, but there's also TRICARE, which is the military retirement healthcare system. This is a different program, so you got to be careful in that. If your administrator says, "Oh, we're signed up with TRICARE," this is not the Mission Act program. And then if you're on the East Coast, you find out what state you're in. There's 3 different phone numbers that you dial in based on where you are in the country, what state you're in. The person on the other end of the line will actually get on the phone and will walk you through their website. I've done this with about 4 different practices now, from South Carolina to Iowa to New York. I've helped, I've helped practices sign up for this. It takes about 1 hour of your time with the administrator of your office. They need to be the administrator that has signatory authority and has access to the medical licenses, the Medicare records of that of your practice. So once you've figured out where you're at and you dial that number and you connect with one of those 2 forms, you just need to ensure, and you need to have the agreement amongst your practice, that you take Medicare reimbursement rates, because the contract that you would sign as a provider entity binds you to take no more than Medicare reimbursement rates. And for a lot of prostate cancer treatments or medications, we're understanding that Medicare reimbursement rates are pretty good. I mean, they're pretty acceptable. Lastly is you're going to be given a contract, and then you need to review that contract. And once it's finished, it's a multi-page contract like you would sign with any other insurance company. You read through that contract, you sign it, send it in, and now the next step is you have to advertise. Once you sign up with these organizations, nobody knows that you're signed up, and the veteran doesn't know that you're now available. Cancer Care or whoever, or Mr. Imaging site of St. Louis or Omaha, they don't know that you're out there. So you need to engage with the local VAs and with the local veterans organizations, things like the VFW, the American Legion, and those sorts of things. Or you can call 0, and we will help you advertise. We'll help sponsor you. We'll help put you out there. We'll help make sure that you're in the community, and that the prostate cancer survivors and champions alike will invite you to our run walks. You can participate in all these kind of activities so that you can engage and network with the local VAs and make yourself known. Make yourself known as a resource. We're not asking you, no one's asking anybody to give and be philanthropic about this. We're asking you to sign up and give of yourself and your resources, but you're going to get paid for it. You're going to get reimbursed for helping the veterans and to take care of this disease that's the #1 cancer in the VA system. And we have there's a shortage. We need some help. We need people to sign up. Like you say so eloquently, Jamie, we need to build an army to take on this disease, to take on this enemy.
We absolutely do. We need more providers, more doctors to come and join us in this fight. Now, after a doctor or a healthcare provider has enrolled in the Mission Act, there are 7 steps in which they have to go through in order to be able to offer care to veterans. Will you walk us through those?
Absolutely. Yeah. First is it's pretty obvious, but the first step is really the veteran seeks care from the VA. So an eligible veteran is one that is already signed up in the VA. He's eligible for health care in the VA. And a reminder that if you're a veteran, there's 2 things that you have to become eligible. One is a DD-214, that's your record of service, and an honorable discharge. If you have that one piece of paper, go into the Veterans Eligibility Office and sign up for your health care. You'll be surprised what other benefits that you get. And we really encourage anybody that's a vet, whether you want the care or not, just go sign up. You'd be surprised. So you have a veteran that's eligible. He goes to see the doctor inside the VA. So the VA then determines, based on there's 6 eligibility criteria. There's some eligibility criteria. The #1 eligible eligibility criteria is that the doctor and the patient decide that the best care available may not be in the VA. For example, I'm facing a very specific issue with my recurrence of cancer. The VA does not have the capability from a radiation oncology perspective to provide me with that service or with that technique that the doctors want to do. Let's just say HDR brachytherapy, right? There's no VA center that has that capability. So they ask me, I ask the doctor, we have a discussion, and they say, call the Mission Act, the referral people, off I go, right? They make a call to TriWest. TriWest searches the database of doctors that have that specific capability that are signed up, and I get an immediate, it took 24 hours, and I had 3 referrals to doctors that are qualified to do HDR brachytherapy. Okay, so then that happened with inside the VA. It's just it goes to the VA referral office. They know they don't have that capability, and that was done by my oncologist. The VA then reaches out to TriWest, who then has a database of all of the contracted providers and what their services are that they provide and the techniques. I then get an appointment. They call the veteran himself and say, we have these 3 openings at these 3 places. What fits your schedule, Mr. Veteran? You go to you essentially show up at your office, so the provider would have on their schedule a scheduled appointment. The veteran shows up. He has his ID card that's matched already in the database. They do the appointment. No problem. They then submit the reimbursement. You essentially give the care to the veteran. He receives his care. It's all done. Now you and the doctor make a determination. Your community care provider make a determination whether you need subsequent care, which you can have the option of doing, and they can prescribe it right there. They can continue on with your care, and they'll notify that provider will then be connected back to the VA doctors, and typically it's like any kind of referral, it's a back and forth. You start a communication with the initial oncologist or urologist, and then your outside doctor. You really want that communication to occur because while IT is growing in capabilities, it's not perfect. And so you need to get those records back to the VA. And that is one of the criteria, is that you need to be delivering those records back to the VA before that doctor gets paid. Okay, I think they're starting to make that as a criteria. And it's not really hard to do that. Then once the provider sends the records back, a record of treatment back to the VA and their reimbursement forms, they get paid. And right now, with both of those firms, I've confirmed before this meeting that we performed our video that both firms are between a 17 and 20-day reimbursement time period. So once you've done the period or done the treatment, submit your forms, they're both incentivized to actually reimburse before 30 days. And that's in their contract, and I think the VA did a nice job. The government finally wrote a really nice contract to actually help these guys become reimbursed to keep these monies flowing.
Now, we had referenced this earlier, but prostate cancer is the most commonly diagnosed cancer within the VA system, as 500,000 veterans are in active treatment right now for prostate cancer within the VA. And Mike, I know you're one of them. So as a prostate cancer survivor who has benefited from this program, from the Mission Act, what's a key takeaway for providers?
Well, one of the biggest issues is that there's a shortage of physicians. There's a shortage of oncologists inside the VA right now. And it's been documented, and they're recruiting as fast as they can to get guys to help out and provide the resources necessary to treat us. One is that you get involved with the VA and with veterans. And it's a pretty interesting aspect of things. I know that there's a lot of research that's going on inside the VA regarding prostate cancer. So there are research opportunities. There's a lot of DNA sequencing issues that are happening right now. A lot of advanced research happening. It's additional revenue for your service, for your practice. You're seeing patients, right? You're trying to increase your throughput. it's a known source of funds. You're not waiting for somebody or an insurance company and underwriters to figure out if they're going to pay you or not. You get referred from somebody, they're going to pay you. That's the contract that's been made. And I think that you also expose your practice to these VA physicians that are very grateful for this. And I think it makes a nice combination of things that to provide the access to pay. I can't find for my specific treatment, like I said earlier, some of the things that I'm being treated with don't exist inside the VA. I mean, and that's why I'm being outsourced. That's why I get referred out. And I'm blessed because I help out with zero, and I'm blessed with having met some of the best and brightest and the most advanced treatment options that you can find, right? So I make it a point to talk with my oncologist and refer them out to these other physicians. And what I've seen through that process, I'm obviously an advocate for this, but I try to network these doctors together, and I try to network the practices inside the VA, and it's opened up opportunities for both the private practice doctors and also for guys in the VA that want to bring in some technologies into the VA and get access. I mean, we have opportunities now. We're trying to fulfill a free program by somebody that by a firm that had given free doses of imaging technology, and they're getting a great access to a database of veterans, and they wouldn't have done that. They couldn't have done that had they not sort of invested in the VA and their relationship with the VA. And so it's a good give and take relationship, and it really is a private public-private partnership. I think that we're really trying to promote. And there's just a lot of benefits we don't even know are happening, I think, but through this promotion.
I know we talked quite often that don't know where you'd be without your amazing team of doctors, even on the outside of the VA. So we need to bring in more doctors, more specialists, more oncologists to be able to build this army to help out our veterans. So if you're a provider out there or doctor out there, what resources are available to providers to get additional information or to have questions answered about the Mission Act?
There is a good, the VA has updated their website. It's at va.gov, and just go in and search for community care providers or for the Mission Act. Both searches will get you to the same page on the va.gov website. Where I prefer that you go to is zerocancer.org/veterans. We will have our flyers up, and we'll have a step-by-step process of how you get engaged, or you can call me and I'll very easily, very quickly, we can get in touch together and walk you through like I've done with other practices. I mean, we're here to help facilitate that sign up, and we really want guys to make it as simple as possible. It really is not that hard. You just need to have an administrator that has the access to the practice's records and data, and then sign up. Just do it, and you'll be eligible for more for more patients and veterans. Supporting more veterans that need your care, need your practice's care.
Absolutely, and again, that's zerocancer.org/veterans. If you're a patient within the VA system, or if you're a veteran who's a patient even outside of the VA system, come and get information at that page, as well as if you're a doctor or provider interested in taking part or just learning more information about how you can continue to provide more help to our nation's veterans through the Mission Act. Go to zerocancer.org/veterans. Mike, as I said before, we've got your back 100% of the way in your prostate cancer journey, and we've got all of our nation's veterans. We've got their backs too. So if you're a veteran, or if you're a family member of a veteran, love a veteran, reach out to us, and we're there to help you every step of the way. And thank you for your service, and thanks for joining us today, Mike, and getting some of the questions answered for our doctors out there.